So now we would discuss about some treatment of the uveitis. Now, first thing that important thing that you should remember is why the uveitis occur. Basically, the uveitis occur because of inflammation of the uveal tissue. So the pathogenesis is inflammation of uveal tissue. So if we want to ask about the drug of choice, so anything that acts on the uveal inflammation and decrease the inflammation, it would decrease the activity of uveitis. So my drug of choice for any type of uveitis is steroids, which decreases the inflammation part. Now we have three different types of uveitis: the anterior uveitis, the intermediate uveitis, and the posterior uveitis. So drug of choice for any type of uveitis is steroids. But for the anterior uveitis, I would prefer topical steroids, and for the intermediate uveitis, I would prefer the subtenon steroid, or I would prefer the intravitreal steroids, and for the posterior uveitis I would prefer the oral or systemic steroids. Okay, because the penetration of topical steroids would be less in the vitreous cavity. Now, what can be the adjuvant treatment? The adjuvant treatment in the case of uveitis can be use of cycloplegics or mediatics. So what are the cycloplegics and mediatics that we can use? We can use hometropine, we can use tropicamide, and if the inflammation is very high and there is posterior synechia, and if you are having a hypopion also, then you can use also the atropine. So what the cycloplegics or mediatics do and how they help in the uveitis? So basically they relieve spasm of iris and the uveal tissue. They prevent formation of posterior synechia, and they reduce exudation and increase blood supply to the uvea. So this is basically their mechanism of action. Now some students ask me why atropine is not the drug of choice for the acute anterior uveitis. My answer is no. Remember, even in the acute uveitis, unless otherwise you give the steroids, there would be no decrease of the inflammatory part, and even if you use atropine, it may not able to even reach the anterior chamber in sufficient conditions because there is a lot of inflammation and there may be a corneal edema also. So first use steroids, and as soon as the inflammation decreases, the atropine starts acting. Okay, so even in the acute cases, your drug of choice would be the steroids. Now second question is asked that what would be the drug of choice for hypertensive uveitis? So first of all, remember what this term means. So basically because of the increased cells and the flare, there is a trabecular meshwork clogging. Okay, so because of this trabecular meshwork clogging, there would be decreased trabecular meshwork outflow. As you all know that the trabecular meshwork outflow consists of the 90% of the drainage. So if the trabecular meshwork outflow is decreased, there would be increased in the intraocular pressure. So this is the basically the pathogenesis of hypertensive uveitis. Sometimes in 10% or even less than 10% of cases, because of use of steroids like predacetate or dexamethasone or betamethasone, you may get a rise in the intraocular pressure. These patients are called steroid responders. So, in steroid responders, the cause of rise of intraocular pressure is the sensitivity to the steroids. So, what would be the drug of choice? Remember, 90% of the cases are because of the trabecular meshwork clogging that causes a decrease in trabecular meshwork outflow. So, in these cases, the drug of choice is definitely the steroids, because as soon as you use the steroids, the inflammation goes down and that decreases the pressure itself. Okay, but if they ask which is the drug of choice to reduce intraocular pressure, remember these two questions are different. Drug of choice for hypertensive uveitis would be steroids, and drug of choice to reduce intraocular pressure in hypertensive uveitis, that would be your aqueous suppressants. Now, what are the aqueous suppressants that you can use? You can use beta blockers, you can use CA inhibitors, or you can use alpha agonists. So, any one of them you can use, but my preference out of them is beta blockers like timolol, because their reduction of intraocular pressure is maximum almost 25 to 30%. Now, another question that was asked is which drug cannot be used in decreasing the intraocular pressure in hypertensive uveitis. So your answer should be pilocarpine, because it can increase the spasm of iris, and PG analog as it can increase the inflammation. So these drugs are not to be used in the treatment of hypertensive uveitis to decrease the intraocular pressure. In some cases, when you cannot use steroids because of, let's say, there is a nephrotic syndrome or the patient is not responding, so in non-responders or where there is a contraindication to steroids, in those cases, you can use immunosuppressants. Now, these immunosuppressants can be the azathioprine, you can use your cyclosporin, or you can use cyclophosphamide, but these are reserved in very few cases. Okay, so here comes the end of the treatment of the uveitis.